Welcome to the BMJ podcast. I'm Cameron Abbasi, Editor-in-Chief of the BMJ. In the UK, we have an election, and around the world, half of the global population will be taking part in elections this year. So, in this episode, we'll be talking about how health and elections intersect. Firstly, what do we know about the plans that the political parties have in the UK for health?
There's been concerns among senior doctors about proposals by Labour to reintroduce the annual lifetime allowance on pensions.
The world's largest democracy, India, is polling. So how are Indian politicians talking about health?
It's a bang in the middle of summer, there's a heat wave, but there's also a lot of heat being generated around the election debate.
And finally, we're going to hear about why this might well be the most consequential election for women's health in the USA.
Elections are often decided in the United States by merely half of the electorate. They're decided by who doesn't show up, not by who does.
First, Abi Rimmer, our UK features editor, is joining us to talk about what's going on in the UK. Abi, welcome.
Thanks, Cameron.
So we're already caught up in election fever. It's all happened all of a sudden, and health is going to be a big part of this, don't you think, Abi?
Absolutely. I think we know that the NHS and health are kind of the public's top issues when it comes to elections. So they're very important for all parties in the UK.
Yeah. And so what are we hearing from the political parties?
Well, to be honest, at the moment, not a huge amount because we haven't had any manifestos yet. I think Labour has probably had the most to say about what they're planning for the NHS. We've had their plan for reducing NHS waiting lists, which is based on this idea that they will create 40,000 additional appointments, scans and operations a week to reduce the waiting list backlog. There's also been talk from Wes Streeting, the Shadow Health Secretary, about how he would like to change NHS culture and reduce the number of NHS staff that we source from red list countries from overseas. So quite a lot from Labour. I am yet to hear a lot of detail from the Conservative Party, although Cameron, you might have heard more than me.
I haven't got a hotline to the Conservatives, Abby, let me tell you that. But in terms of Labour, I think we all know that they've made some particular statements, and one of which is around using more of the private health sector to meet demand. So some of it sounds like exactly what people want to hear, such as reducing waiting lists. But clearly, I mean, some of these things are also controversial, aren't they? I mean, there's going to be it's going to divide people.
Absolutely. And I think for our sort of audience of UK doctors who work in the NHS, they'll be more than well aware that often the staff who work in private hospitals in the UK are also the staff that work in the NHS. So it seems a contradiction in terms to try and reduce NHS waiting lists with staff who are already working in the NHS. You know, there aren't more staff. That you're just moving them around. So I think there's a question on how that would actually work in practice.
No, I agree. I think this is one of the concerns people have, is that everyone's working flat out. We have a retention and recruitment crisis. Yes, there are one or two pilots that have shown how you might do things better, such as a waiting list initiative that rapidly got cut down people's waiting times and reduce the list. But whether or not that's generalisable across the country is a separate question. And of course, when you look at waiting lists and you look at private healthcare, as you've just said, it's using the same staff as generally work in the NHS. So that's the bit that doesn't seem to square for anybody.
No, and I think also you just made me think that this idea of, this 40,000 extra appointments, a lot of that will rely on kind of discretionary NHS staff, extra effort. They're planning to have these on weekends and the evenings. And we've recently seen, we did some reporting on NHS productivity and how much of that relies on the discretionary effort of staff. But I think there's an awareness within the NHS that actually you can't rely on that for too much, too long. And there's only so much that staff have to give.
No, I agree with you, especially after the pandemic and everything, people working up against it even before the pandemic. Actually, I'd love somebody to do an analysis. I've even asked our team to do an analysis, but I think it's quite hard to get at the data of how much unpaid overtime people do in the NHS. And I think if we calculated that already, it would be a staggering number. So if anybody out there's got the data, do let us know. So, Abi, in terms of the doctors and the profession, what are you hearing from them in relation to the election, and how are they responding to these early signals from the parties?
Well, interestingly, and slightly, I suppose not completely off the topic of health, but slightly tangentially, there's been concerns among senior doctors about proposals by Labour to reintroduce the annual lifetime allowance on pensions, which would mean a lot of senior doctors would see large tax charges and potentially force them into early retirement to avoid those. So I think quite a few people are unhappy about that. To be honest, though, I don't have any extra insights necessarily into how doctors are feeling.
So when it comes to the BMJ, we cover every election, and we cover everything. We cover every election everywhere, it seems to me, as we're about to do in this podcast. What are our plans, Abi?
That's a really good question. I don't know if I can answer that yet. Shall I ask you?
Okay, well, I think what we're going to do, as usual, is at least, we'll do a roundup of the manifestos when they're available. We'll have an ongoing critique of issues as they arise through opinion. We'll cover them in news. We've also got a NHS manifesto. What should be the manifesto that a party should have going into this election? That's going to be written by commissioners from our NHS Commission on the Future of the NHS. And of course, we'll also do our ever popular feature on doctors who are standing for election. People always love that, to see which doctors are standing, where are they standing, what's their background. It's always a very interesting read as well. So, Abi, I hope you found that helpful.
That was great. Thank you very much.
Thank you, Abi. Now, around the world, election machinery is cranking up, and as we're about to learn, this can also come with a toll on health.
My name is Charu Bari, and I'm a freelance journalist, and I live in Rajasthan, that's in West India. Elections were called in India in March. And so we saw campaigning right at the start, soon after the announcement. So I saw women in my neighborhood, men and women from my neighborhood, travel a couple of hours to attend a rally, their favorite politician, spend 5-6 hours in the heat, and travel back. And by the evening, they'd come back, and the next day we'd hear that so-and-so was sick and so-and-so was sick. So the thought struck me that if women in my neighborhood were falling sick, then how many more participants of those rallies were falling sick as well? And I started to read up what happens in other countries. And it was very interesting. Indonesia, I learned that the entire country polls on a single day. And organizing, just the logistics for that is huge. The government recruit volunteers, they train them. And, even then, the whole process of voting and counting, it really takes a health toll. This year, 181 election officials, these are mostly all volunteers, they died during the course of the election. And so many thousands more fell sick. It's just so strenuous. Falling sick is one thing. Suffering trauma, people who attend large rallies, in populous countries like India, and there's also people who've studied this subject in Taiwan, where they have very intense campaigns for 4 weeks. The chances of stumbling in a large crowd gathering, especially if you're of an age, are very high. And so you actually have researchers who've come up with the figure that the health expenditure increases, can increase up to 19% for a first-time voter. that's quite a significant increase in healthcare.
I'm joined now from India by Sanjay Nagral. Sanjay is a surgeon and director of the Department of Surgical Gastroenterology at Jaslok Hospital and Research Centre, bit of a mouthful, in Mumbai. But importantly, Sanjay is also co-chair of our South Asia Regional Editorial Board. So Sanjay, welcome.
Thanks, Kamran.
Great to have you with us. Now, Charu there talked about the rallies that are happening in India. Clearly it's a big election in India. It's always a big election in terms of health. What conversations are taking place and what are the big issues?
Yeah, so, we are having an election which has been quite long, 6 weeks, I think 7 phases. It's the bang in the middle of summer. There's a heat wave, but there's also a lot of heat being generated around the election debates. And really, if one looks at Indian elections, it all starts off with issues of employment, development being debated. But often towards the later part, it gets bitter, it gets divisive. I think it has something to do with the fact that most Indian politicians, and they are very astute people, they realize that finally people vote not so much for necessarily for issues like health, but they vote on identity, caste, regional issues. So they quickly get down to that. And that's exactly what we are seeing, that we've largely forgotten about some of the manifesto issues around health, which all the political parties have brought up in their manifestos. I would have thought that with the kind of COVID devastation that India experienced, we would have had a lot of discussion on health infrastructure, and how it collapsed during COVID, etc. But we are hardly hearing any conversation around that. I think, yeah.
Well, that's surprising. But things move fast in India, don't they? The conversation moves on rather rapidly from day to day. One of the issues, though, long-standing, that's always in the background is how can India achieve universal health coverage? Is the current government, which looks like it's probably going to get re-elected, are they committed to this? And how much progress is being made, Sanjay?
Right. So I think it starts off with what is our definition or understanding of universal health coverage. So as you may perhaps know, in the last decade or two, governments in India, both at the center and state, have really adopted the policy of mass-based insurance schemes, which the government funds, through which they buy care, both to some extent from they even pay the public sector, but largely from the private sector. And that's actually, in my view, a tacit kind of admission that through its own infrastructure, the government can't deliver care, especially secondary and tertiary level care. So there are these schemes. By the way, healthcare in India works around schemes and grant schemes, and it's often associated with election promises. So there are grant schemes announced, which are sort of supposed to get votes. So just to go back to the universal health coverage issue. So I think the big story from India is a huge private sector, which is moved into the vacuum left behind by the government or the state being absent in several areas of healthcare. I think what they are trying to do is to tame the private sector into delivering care to people on their terms.
Yeah. So when you hear of the UK talking about using the private sector more, I guess that makes you a little skeptical.
Oh, it does. And, incidentally, in India, even politicians and people writing in the public often refer to the NHS as what we should aspire to. It's one of the mysteries to many of us that when the British left India, they had a blueprint for the NHS kind of model in India, and all our early policy documents talked about an NHS kind of model, and it's really a mystery as to where we lost our way. But of course, we still aspire to the NHS, and so therefore, when you talk of the private care being creeping into the NHS, it is I must say learned from the experience of India, where there
Yeah.
is this talk about long waiting lists, and of course that's a challenge. But you can get an operation the next day in India, but you'll have to wonder whether that operation is really necessary. So it cuts both ways.
No, exactly. No, of course. Actually, well, you just told me something I never knew, which is that there was an NHS type model proposed for India. Is that? I mean, so who? This was. How did this come about?
Yeah, so then when
Tell us more
yeah,
about
yeah,
this.
sure. So when the British, so around independence time, there was a committee set up by the British, which set up the blueprint for Indian healthcare. And post independence, we had that as the policy model. So it all started with building up of public hospitals. Uh, However, I suspect what happened is that the state's presence in healthcare did not quite keep up with both the expectations of and the demands of a country of India's size. But there were always these private providers, which were small time, which soon became big. And then, of course, around the 60s, 70s, you had business people who started big hospitals, presumably to sort of serve people, but soon realized that it's good business and it's a cash cow. So now we have, of course, private care, which is posh, which is very big now, and it can be very efficient. It can provide healthcare with very good quality, what they call in India world class, whatever that means. But what it means is that most of our people can't afford it. So we've reached this stage, and now we are firefighting. Yeah.
You talked about earlier on, Sanjay, about these grand schemes. I mean, I can imagine how they're announced. But are there any? What grand schemes have been announced this time around, if any?
Yeah, so this time around, the manifestos of the two prominent parties basically talk about. So the ruling party, the current ruling party, already has the scheme, which is goes by the name of the Prime Minister, actually, called the Ayushman Bharat National Health Protection Scheme. It's the largest mass insurance scheme in the world. I mean, by India's sheer size, it involves a very big proportion of the population, around 40%. But they're covered for 5 lakh rupees per year for the whole family. So anything beyond that is not covered.
So that's 500,000 rupees you're talking about. So that's £5,000 per family. About
Yeah,
something like
sort of
that.
divided by 100. That's right. And
Yeah.
so
So it's not a lot
it's
of
not a
money
lot of
in
money.
healthcare
No,
terms.
it's not a lot of money at
No.
all, and therefore, very often the coverage is much. You need a big illness, and it can't cover it. So that scheme is being expanded. On the other hand, the Congress, which is the other large opposition party, which is leading a block of opposition parties, has claimed in its manifesto that they promise universal and free healthcare. They have a cashless insurance model which they try to introduce in a state they ruled, the state of Rajasthan, which would cover 25 lakhs of insurance cover. So as opposed to the 5 lakhs. So there's that kind of competitive election promises. I always say that it's great if parties compete on healthcare. That's what we want. Um,
So if that's what the parties are saying, what are the public asking for? Are there any particular big issues when it comes to health that the public are raising?
So the people, of course,
Or the big...
yeah. So people often ask for essentially access to health. It depends on who you are. So for the large number of people at the bottom of the social hierarchy, it is purely access to decent care, not even very high level care, just basic decent care. For the emerging upper middle class, they have the private sector. They believe that they have sorted out their own healthcare, but they are also unhappy because costs are very high. So therefore, in a sense, they ask for cost control. So that's how it's gone. It's about who you are in Indian society, and really there is no unified combined sort of unified demand simply because you have these two parallel systems. And people actually, even the poor today, given the state of public care, aspire to access the private sector. They think, and probably it is to an extent quicker, efficient. It sort of is superficially polite, and so on and so forth. So the poor actually are slowly moving to the private sector, but with the attendant costs. So this scheme is actually quite popular, even the mass insurance schemes, because they get access to a sector which they could not previously access.
Sanjay, thank you very much, and look forward to speaking with you again.
Thank you.
Thank you. Finally this week, from the largest democracy in the world to one of the oldest, the US is entering its presidential election phase. I'm sure you've noticed. And access to abortion and women's rights are key talking points. We're delighted to have Jody Heymann, founding director of the World Policy Analysis Centre at UCLA. Jody, welcome.
Thank you. Pleasure to be here with you.
Now, we think this is going to be a really fascinating election to watch, particularly in relation to women's health.
Yeah, fascinating is one word for it, I think.
Okay.
Fascinating, terrifying. It's certainly the most consequential in our lifetimes for women's health.
Why do you say that?
Abortion is the beginning, and we've seen a lot of attention justly paid to that, because it's not just access to abortion for women who make that decision, tough or not in the individual case, to terminate a pregnancy. It's also access to abortion for those who have no choice, for those whose life is on the line, for those whose fetus is never going to survive, has a condition they can't survive, for tens of thousands of women and girls who are pregnant because of a rape. And beyond that, though, this election matters really stunningly to some of us for contraception. There are threats being made to whether all women and girls would have access to choice about contraception. And it matters to other aspects of health. For women who have children, do they even get the leave or time they need to care for their own health and for the health of their children?
So it sounds like there's a full-on assault here on women's health. I mean, it would be incorrect to characterize this as something that's across the US. I mean, there are particular states that are particularly aggressive in relation to the issues you've mentioned.
I think these matter both at a national level and at a state level. So decisions that are made by the U.S. Congress, so our national elections for congressional representatives, for senators, for the president, will shape each of these areas. And everybody who works in health in the United States should care about their state elections, because state law affects access to contraception, it affects reproductive decisions, and it affects women's health in many other ways. I'll just mention one. For women who do have a pregnancy and give birth to a child, the United States is one of just a handful of countries, along with Papua New Guinea, 5 small South Pacific Island states, that don't have paid maternity leave. That matters to women's survival. It matters to infant survival and health. So those decisions are going to be made at the federal level. Again, in this coming administration, there also are being made by states.
How is it possible that a country like the US can have a policy that is so discriminatory in the 21st century? How can it be, Jody?
I think as healthcare workers, whether we're physicians, nurses, public health people, whether we're academics, we have often been taught or acted as if our role is to stay out of politics, to stay out of government. I simply think we can't afford to anymore.
Clearly, as you said, it's a critical moment for women. I mean, everything you mentioned there is something that can be addressed by politicians.
Overwhelmingly, these are political, and overwhelmingly, the solutions are not especially complicated to come up with, which is why I think we do at last need to come off the sidelines and start doing what's been recognized for centuries, which is if you care about health, you have to care about policy, and that means caring about elections.
And are there signs that that is happening?
I think there are signs that that's happening around abortion and around reproductive health writ large. The reality is the majority of the country of all parties believes in more reproductive choice. But the political candidates are quite divided on the issue, more divided than the citizenry. That's the same with paid leave. Paid maternity leave, Democrats, Republicans, independents. The majority of everybody believes mom should have time, and dad should, to care for a new infant, that they should have time to care for their own health and be able to afford to and not land in poverty. However, when it comes to the party votes, this is really something that's largely democratic and centrist, has often been opposed. So the parties are divided on this, opposed by the right wing of the Republican Party. The parties are divided, but the electorate isn't, and we're going to need more electoral engagement in them.
Yeah. When you look from the outside, it looks as if the US is heading in a particular direction on women's rights and women's health, and that's one of, incessantly eroding both of those. And I just worry that we've got to a stage where it's quite hard to claw things back. The political environment seems pretty toxic, and I appreciate health workers and health professionals should raise their voice, and they can do, and they can be influential. But presumably this needs very strong political leadership to turn this around.
So I do have faith in our democracy, and I think for all of us, and it's not just health leaders, it's everybody who cares about health, it's every step we take. Right? It's raising voices, it's voting, it's helping ensure others can get to the polls, it's letting your representatives of any party know these issues matter, it's a level of engagement. And I don't think it's a foregone conclusion which way it's going. Battles have been lost, there's no doubt about that. But many people are far more activated now than they have been in many years to advance women's health. And the question is, will we put in the time? Will we be effective enough? Will everybody work on it to turn this around?
Yeah, and more immediately, I mean, women can use their votes to help shape the future here. And I think there is more and more of that conversation taking place as well, isn't there? Their
votes. And every single time you have lunch with someone, dinner with somebody, walk with someone, are you asking them, are they coming out to vote? Are they thinking about the issues? Are they learning what the different candidates stand for? Are they talking to other people in their networks to make sure they vote? Elections are often decided in the United States by merely half of the electorate. They're decided by who doesn't show up, not by who does. We have to reverse that.
Well, we'll be watching with interest, Jode. Listen, thank you. And thanks for writing that piece on maternity leave. That was really excellent. Thanks for that.
Thank you, Cameron.
That's it for this week. We'll be back in a fortnight. Subscribe to us wherever you listen to podcasts. Until then, I'm Cameron Abbasi. Thanks for listening.